Jamey, great to see you again. Great to hear what's next for Cloudbreak.
Hi Logan, how are you?
Happy to have you into the studio. All right, so
happy to be here.
I know what Cloudbreak's all about, but why don't you break it down for me for the sake of our audience?
Sure. Cloudbreak is a telemedicine company that provides language interpretation services in healthcare as well as a unified telemedicine platform. We're currently doing it at over 1,200 hospitals across the country, over 85,000 times a month.
Wow.
And we really classify ourselves as a healthcare disparities solutions business.
Okay, so you just said three things in there that I think are worth breaking down. You said we were a telemedicine company, and then you linked it to interpretation.
Yep.
And then disparities. So let's start with, what's the link between the telemedicine and the language services?
Sure, so our mission is to humanize healthcare. And what that means for us is being able to increase access to care for people who need it. And if you take a look at some of the most challenging patient populations in our country right now, they're people who don't speak English, they're people who recently emigrated to the country. And for us, solving the problem for them and knowing that a hospital is one of the scariest places that you could potentially be, even when you speak English, but being able to solve that problem and empower them to take control of their care and not have people racing around their ER bed wondering, oh my God, what are they saying? What are they going to do to me next? It also empowers the doctor, though. So one of the main missions that we have is to fight burnout. And so how do you fight burnout? You put great tools at the fingertips of the physician that actually make their job easier, and having an interpreter readily accessible on the platform helps them do that and helps them speed care to those patients.
One of the things I love about talking to entrepreneurs at the festival is hearing when people go upstream with a problem. And so there's a lot of telemedicine solutions, but here you are moving up to the issue of the ability to communicate, language, and how you can't have a great telemedicine platform unless you can communicate clearly.
Yeah, so for us, communication is the number one diagnostic tool that a doctor has. When they don't have the ability to communicate, what do? They practice defensive medicine. They order a bunch of unnecessary tests that they don't need. A patient comes in clutching their chest. Is that an indigestion workup or a chest pain workup? You solve that by being able to communicate with the patient. So our goal is, how do we speed that communication? How do we make it easier? How do we allow the patient and the provider to build a trusted rapport so the patient feels comfortable sharing what their issues are with that physician?
Yeah, so I know Cloudbreak is kind of behind the scenes, and infrastructure, and kind of supports, so it can be hard to sort of paint a picture of what it looks like, but kind of help me understand what my interaction might be like if I was using a provider who has Cloudbreak supporting him.
Yeah, so at its core, the language services use case is what we refer to as the gateway telemedicine drug. It allows us to get throughout the entire hospital. So our goal is to have a unit accessible wherever a patient is in a facility. And the encounter looks like for them, they come, they present with their issue, someone rolls one of our iPad Pros up to the bedside.
Like an IV pole with a pad on it?
An IV pole with an iPad on it, yeah. Very simple, easy to use, very intuitive. You hit a button on the screen, you get the interpreter that you need within 30 to 90 seconds.
Oh wow, okay. And those are part of your company, they're part of a call center, a service?
Yeah, so the interpreters are the part of the service, the service continuum that we own.
Got it.
So they're W-2 employees in US-based language centers. They're certified medical interpreters.
Wow.
They are the highest bar of interpretation you could possibly have in this country, and that quality is really important. Our providers need to know that the person on the other end of the line has the appropriate skill set for them to service their needs.
So once you have the infrastructure in place for clear communication, then you've got the iPad and you're ready for telemedicine. You've got you have the pipes laid.
Correct. And once those pipes are laid, we started to expand the use cases, Logan, to do things like telestroke, to do things like telepsychiatry. Because the system is there and so easy to use, our hospitals have asked us to expand use cases on the existing platform.
Awesome. Okay, we only have a second, but what are you most excited about for 2020?
I am most excited about this next chapter for Cloudbreak and the fact that these new use cases help us solve more healthcare disparities than we could solve before, and it's really the mission and purpose of why we get up every day.
Awesome. Jamey, thanks for coming by. Hope it's an awesome festival for you, and keep up the great work.
Thank you for the opportunity. We love coming to StartUp Health every year. It's one of our favorite times of year.
Awesome. All right.